Hi everyone, my name is Ariel Carmen. I'm a nurse practitioner student at Morningside College, and this is my NP elevator speech. So, what is a nurse practitioner? Nurse practitioners diagnose and treat patients. They promote health across the spectrum for patients. They perform disease prevention, and they prescribe medications and treatments when necessary. Nurse practitioners are becoming increasingly more common due to provider shortages, especially in primary care, and also an increased number of elderly patients, particularly because the baby boomers are starting to get older. It's important to know the difference between a medical doctor and a nurse practitioner because they are different modalities. There's different education. Medical doctors go through medical school after they get undergraduate degrees, and then they perform a residency. With nurse practitioners, a lot of time they're master's prepared and sometimes doctorate in nursing practice prepared. Medical doctors treat specifically, a lot of times with medication, procedures, surgery, very succinct things. Nurse practitioners kind of look at the patient overall as a whole. They do holistic prevention, they do overall management of the entire patient. They can work inpatient or outpatient, just like physicians. They can work in primary care or in a specialty. So you'll be able to see nurse practitioners in a lot of different venues. Nurse practitioners have clinical judgment. They use evidence-based practice. And one of the very big mainstays of nurse practitioner treatment is that education for your patients is very huge. Nurse practitioners will often spend a lot of time with their patients just doing education so the patients really are aware of what's happening and how they're being treated. The nurse practitioner also will coordinate care with the patient and look at what other physicians are treating the patient, what other treatments they're receiving, and coordinate their treatment as a whole. So in conclusion, it's important to know that the nurse practitioner role is becoming more prevalent. It's important to know what nurse practitioners are and what their treatment looks like. It's important to know what they will and will not do, how they differ from physicians and physician assistants. Thanks.